Today we're going to talk about acute lower back pain, and we have here with us Kate, the back physio Adams, and we're going to start by doing a quick little introduction into the biomechanics of the lumbar spine. G'day, how's it going? Before we can talk about how to manage back pain, it's good to have an understanding of how the spine works. So we're going to show you just quickly, this is the lumbar spine, this lower part. And what's really important about the lumbar spine is the orientation of the facet joints. You can see either side of the spine, we've got a left and a right facet joint. And in the lumbar spine, you can see that it's predominantly set up for flexion and extension. The lumbar spine also does laterally bend to the left and the right. You can see how the facet joints permit that. What it doesn't permit so well is twisting. There is a minimal amount of twisting through the lumbar spine, but you can see here, because of the way the joints are orientated, they're going to bash into each other. So really the amount of twisting available at the lumbar spine is just to cater for incidental twisting motions. If you come back up into the thoracic spine, you can see here, yes, flexion and extension is permissible, but because of the orientation of the facet joints, this permits rotation, and that is where most of the rotation occurs. So think of things like golf swings, tennis shots. That's where the majority of the rotation comes. Of course, there's hip movements as well, and then in the cervical spine, because our eyes are in the front of our head, we need to be able to maneuver the head in all positions, twisting, forward bending to the side, so that we can see where we're going or see who's coming after us. But today's about the lumbar spine. We should also add the pelvis is essentially a very stable base. It doesn't have a great deal of movement, but you'll see these large joints through here. These are the sacroiliac joints. This is your sacrum, this is the ilium, and they will sort of twist like that. But from memory, I think they only have about 3 degrees of freedom, so it really doesn't twist very much, but we should consider there is some movement in the pelvis. This whole discussion today we organised, it came about because of something that currently exists on the website on how to manage acute lower back pain, which we reviewed the other day and felt was probably a little outdated. If I just refer to it quickly, I've written on the website here, what should I do if I experience back pain? So this is like if you're stuck at home and you can't get into the practice to see someone, you're in a really, really bad way and you don't know what to do. And I took this information out of Robin McKenzie's book, a New Zealand physiotherapist, on how to treat your own back. And the basic protocol was to 1, rest, 2, walk around, and then 3, do not bend. And he talks about how if you had cut the back of your finger, you wouldn't bend it because that would split the wound and it would continue to ooze blood and bleed. And that's why he was saying, keep it straight until such time as it's healed, and then you can reintroduce bending. And
this is the classic recommendation that lots of people will recommend if you're in this position. And a simple analogy like the bent finger makes sense, but the spine is a lot more complex than this. And for a lot of people, being told not to bend, the number of patients I've seen who have minimised bending for years because the doctors told them to rest in bed for days if they've hurt their back and then not bend, they stop bending, and that is the unravelling of their spine. So rather than protecting your spine from not bending, stopping bending and normal movement that helps the metabolism of your spine really makes things worse. So this is why we need to address what we're telling people.
Yeah, and it's a sensitive issue too, because I'm sure Robin McKenzie and followers of him understand the importance of flexion too. So we're not necessarily completely separating ourselves from them. We're trying to form a bridge between the two. And
it's a simplistic approach, because with McKenzie they say if it's painful to bend, don't bend and extend, and if it's painful to extend, do the opposite.
Yeah.
So just giving one idea of not bending isn't actually helping both ways.
Yeah.
But I think generally in terms of principles of making your spine better. And what everyone really wants to do is move. You know, people are afraid. The reason why people don't want to bend and don't want to move when they're in that acute position is they're afraid of making things worse.
Yep.
So they just say, if I move and it's sore, is it going to make things worse? And that's why they don't want to bend.
Yep.
Whereas once
They'd
you
rather just
encourage
freeze.
them, once you encourage them to start getting some movement, they actually want movement. You know, our bodies are made to move. We crave movement. It's just doing it the right way.
So that was my original sort of protocol or advice for somebody who's really, really struggling. Let's say there's a patient who's at home, they're in acute back pain, it's really, really bad. How do we advise them, do you think? What do you think is the best way to do it?
So number one will always be medication. Number one is always medication.
So if you're really, really bad, pop a pill just to take the edge off, yeah?
Well, depends what state you're in. So I would always start with a anti-inflammatory, Nurofen, Voltaren. If that's not enough, I'd boost it with a paracetamol. So you can take both of those together usually, as long as they're not already mixed. And for most people who are still managing to get about but are in quite a bit of pain, that normally takes the edge off enough to allow some movement. If your body's really locked up and your muscles don't want to let go, however tough you think you are, there's no going against it. And for some people, they need to see the GP and they need to get muscle relaxed.
Is it always necessary? So if we're saying that the first thing to do, analgesia, that's take the edge off the pain.
Yeah.
Do we have to?
I would. If you're in acute pain, if I treat a patient and I send them home and they're a bit sore afterwards, I want them to take something.
Okay.
So ultimately we're trying to encourage normal movement. And if you're in pain, you don't get normal movement. So if taking a tablet allows you to create normal movement again and get over your issue, and it may be, for some people that acute pain may only last a few hours, and knocking that pain off and allowing normal movement just gets them back to normal. They might not need to take another one.
Okay. So what about the argument, if I take a painkiller and now I start moving, will I not be moving in a way that aggravates or makes it worse?
Yeah, so that's the reason why a lot of people don't want to take painkillers. They feel like if they mask the pain and then they start moving again, they're going to make things worse. Generally, I feel that
it just doesn't happen that way.
No, your body, often with the people who get the pain like this, it's almost like an overreaction of the body, and you get this muscle spasm. You can't move around.
I think that's a good
very
point.
Well. Not everybody reacts in the same way.
Yeah.
But for a lot of people, it is an overreaction. The body wants to protect itself, yes, and it's encouraging you to rest, yes.
Yeah.
I wouldn't take a painkiller and an hour later, if I felt great, I'd go down the gym, certainly.
Yeah.
So I'd still encourage rest for that day, but normal movement is the most important thing. And if you can take a painkiller and you get your normal movement back, you're going to be strides ahead of everyone else.
So you think the benefits outweigh the risks?
Totally.
The benefits of taking a pill and taking the edge off that pain outweigh the risks that you might be moving in such a way that you'd be making it worse.
And really, normal, controlled movements, doing some gentle stretches and movements on the floor, generally getting around your house and doing your day-to-day living, you're not going to make your back worse. You really, to really hurt your back, yes, it might be painful, but to really hurt your back, make things worse, rupture a disc, you've got to do a lot.
Pretty serious stuff.
You've got to do a lot.
That's a good point. Okay, so the first part of the protocol, one, is analgesia. Take something to get rid of the pain or make you feel easier.
Yeah.
What's the second thing? Because I've written down a few things here. Would you go into a position of relief after that, or would you get started on some movements, and what would you suggest those are?
Well, I think on your previous the website it said rest.
Yep.
And I totally encourage rest.
Yep.
So but we want rest interspersed with movement. So the aim is to settle things down, and number one thing I tell any patient is listen to your body. So you need, if your body is telling you need to rest, you need to rest. For some people that may be lying on their back, for some people that may be curled up on their side, and for some people that may be on their tummy, and you need to position yourself in that position as comfortable as you can so you can properly rest and let things settle down.
Okay.
So I think you need to rest, but you also need to make sure that you're getting some movement in between that. And we've got the exercises that we'll show, which I want someone interspersing. So I don't want you going to bed for a day or 2 days or longer and not doing anything. If you're resting, I'd normally say certainly hourly, within your rest, you're doing some form of movement.
So that might be pelvic wiggling.
Wiggling. It might be gently trying to bring your knees up. For some people, they can bring their knees up and they can get into rocking straight away. For a patient I saw the other day who was in a lot of pain, it was just bringing his heel towards his bottom. So any sort of movement, just to try and encourage some movement around that lumbar spine, to encourage the muscles to move and let go, get out of their tight spasm. So a small amount of movement, easing you in the right direction, rather than squeezing and trying to fight the muscles. But if you're in muscle spasm, pulling too hard and fighting against the muscles, they're always going to win.
So you have to tone the level of movement to the degree of pain that you're suffering.
And I think people are desperate to get better, but I'll tell people to book a couple of days off work. You have to rest. So number one, yes, you have to rest, but it's not that lying down, don't move rest. So you have to rest, but you're interspersing it, ideally hourly. For some, it may be more, with some form of movement. And your movement may be, I'm just doing a few minutes of just trying to ease one heel up towards the bottom, and then trying to do the one with the other side, a little bit of wiggling, and that might be enough. And then I might rest for another hour, and slowly you'll start to get more movement as opposed to rest, and you'll be able to get up and start walking like him.
Why don't we quickly demonstrate some of that stuff so people can see what they could try in the future. So if we're going to choose rest as the second option, interspersed with movement, there are 3 positions that I have learnt of that are good for just quietening down the discomfort in your lower back. And the first one is the one given by Robin McKenzie, where he says to lie face down on the ground with your head turned to one side. Fortunately, we've got a bench here, so I'll demonstrate on that. But the whole purpose for lying face down on the ground is to restore the lumbar spine's natural lordosis. So that is the concave curve that it should exist in the small of your back. So that's the neutral position, and the thinking there is that if you're in a neutral position, that's a better position for you to be in. So in whatever way you can, find yourself getting onto the floor, and say it's in your living room, you'd have your arms by your side with your head turned to one side like that, and he suggests resting like that for 3 minutes. If you have the luxury of having a bench, even better, you can rest like this. And you just concentrate on your exhale. As you exhale, try to envisage your lumbar spine sinking from, saying, a very stiff, rigid, flat back into this sort of more lordotic concave curve. If lying down like this is very uncomfortable for you, which it may well be in acute lower back pain, he suggests putting as many as 3 pillows underneath your pelvis. So if I can just grab some pillows, thanks, Kate. I want to grab another one as well. So it could be cushions, whatever it is, big thick blanket. You want to try and put this part, the pubic region. Would you say that's about right, Kate?
I'd probably have it slightly higher. So for a lot of people, the discomfort in this position is that it's taking you into extension. And when you're sore here, especially if the pain's coming from the facet joints, if you go further into extension, those facets are going to shout at you.
They'll pinch.
So we're trying to give you a resting position, but allow those facets to open up a little bit. So bringing your pillows a little bit higher, sort of underneath your belly button into your tummy, just allows this to come out a little bit more. Yeah, and at times I've done this, and I've had about 4 pillows underneath my tummy. So you have to go with where your body's calling.
I remember in the McKenzie sort of mentality said that maybe after 2 or even 3 minutes, you might then take one pillow away and slowly come into a more neutral position. But you don't want to rush that process.
Yeah.
If you're happy with 4, just stick there.
And it depends where you are. Obviously, we're sort of covering those who are really, really struggling to move, and then we're covering those people who might have had an acute pain and aren't quite so bad. Now, for those who are really, really struggling, they may be on all fours, and they may think, well, how do I get from here? So you might be in an all fours position. See if I can do it on the bed without falling off. So they might be in an all fours position. They might struggle to get down. So starting with a lot of pillows is going to give them some confidence to come through that all fours and then come down into the resting position. And then they've got these pillows here to support the back. For others who are a bit more advanced, they might feel the need to get into that extension, but they might start from what is a comfortable child's pose position, not even all the way into child's pose. So often I'll encourage people to work towards child's pose, so we're getting some flexion through the back, and then they're easing down in towards cobra, so they're allowing the spine to come down, but they might not fully be ready to relax down. So again, you come back, and then you can rock into that position and rock onto the pillows, or come down onto your elbows if they're comfortable onto the elbows. So you're slowly working towards a position rather than getting straight in. Yeah,
that's a good point. Yeah, rather than just trying to get to that position.
Because so many people will give up. You know, they'll say, "Well, that's where I'm supposed to be, but I can't get there." Yeah. And it's learning to listen to what you're working around where you know you need to go. And for some, they might try that and say, "No, there's no way, I can't do that." Okay. And then there's other options.
So that's the first one, lying face down. And the next one I know of, as a position of relief, is to simply lie on your back and taking relief out of your board. Getting onto your back might be an issue, so we'll cover how to do that. But let's say you've managed to get onto your back. You'll lie in what we call the hook lying position with your knees bent, feet flat on the floor. And what this does is, if you think of having your legs extended, what that does is it relatively extends the pelvis in relation to the back, or it creates mild extension in the facet joints and impacting type sensation. If you bend your knees, it sort of flexes the pelvis and positions the lower back closer to the floor, thus opening the facet joints, giving them a bit more room to breathe. Correct?
It just allows you to relax. So a lot of people on their back feel like they're arching, and if they're in spasm, it's sort of pulling them even further into spasm. As soon as you start to bring the legs up, the back starts to feel the support of the ground and allows that spasm to ease down.
Okay.
And for some, again, they might really struggle to get in this position, and they might need some help at home with moving their legs. Yeah. Often I'll get patients to pull up, so I'll help them, but if you pull up through your heel, by squeezing yourself up or pulling up through this area, people feel a little bit more comfortable about moving their leg rather than having to lift the whole weight of the leg. Yeah. So I can both help you and give you a little bit of resistance that makes you feel a bit more comfortable. And then once you get to the position where you feel comfortable, then we'll let you rest there. You might need some support in that position.
So building on this, that's the hook lying position. Probably the most ideal position for relief from lower back pain is the astronaut position.
So this really offloads the spine.
And this is otherwise known as the 90-90 position. So this is your body, these are your thighs, and these are your legs. So you're like this. And if I'm to demonstrate, if we just grab a mat there, I'm going to flip this out. So if I get onto the floor, we'll just use the bench here. So you might use your couch at home, it might be a chair, anything where you can position yourself on the floor and then get your legs
Obviously it would take you a lot longer to get into this position.
Yeah,
it may take a while to get there, but once you're there, this is lovely.
So this is just an extension of the hook line position where I've really completely unloaded my lower body from the lower back. This is full decompression. And I haven't met anybody with lower back pain who hasn't enjoyed this position.
Yeah.
But as I'm lying here, I just think about that point. How do we get there? I know that Stuart McGill talks about getting to the floor. And he says, squat to sit, lunge to get to the floor. So again, remembering that if you're in acute lower back pain, this might be difficult, but you want to try and lunge, and then if you've got something like the couch, you can support, and then get into a kneeling position, and then you squat into your heels, and then you sort of crawl. And here we are again, like on the face down position, aren't we? We can do this rocking onto the floor. We might get onto our elbows, and now we're faced with the issue of trying to turn onto our backs, aren't we? So maybe we can eventually roll. Is there anything that you do differently to get onto the floor with that one?
Getting down, I'm trying to think how I normally would get down.
It's going to be hard to do it without being in any pain.
And I think everybody has their own ways that certainly use things. So chairs, coffee tables, side tables, things
other
like
people.
That.
Yeah.
If you need to. But the importance of the floor we should talk about as well, Tom. So for some patients, they literally struggle to get out of bed. They really need a lot of help to get out of bed. But if you're in that position where you're in a lot of pain, but you can get up and move a little bit, the floor is the best place for you. So being on a mattress, however firm the mattress is, your body always knows that whatever's underneath you isn't fully solid. So you've got this anxiety of your muscles, if you'd say it like that. You know that one small move and you have to support yourself.
You need the reassurance of a firm, completely firm.
There's no way like getting your body to relax like lying on a hard floor. And make it comfortable. Put a yoga mat down, put some towels down, but you need to know that what's underneath you is not going anywhere, because that just offloads. It just gives you so much more confidence that you're not going to hurt yourself.
So those are the three: lying face down, hook lying position, and the astronaut position. Okay, so we're now going to go through these movements that we're going to intersperse with the rest, and this will be from those positions of relief, and ideally we're trying to get towards being in the astronaut position. So I'm going to start in the hook lying position first, and Kate's going to take it from here. Is that right, Kate?
Yep.
Yeah.
So when we're in this position, ideally the higher up you bring your knees, the better. And for some people, they may start far out. They might just have one or two pillows underneath their knee, and the aim first is to get their knees up towards their chest.
So in this position, I might have some pillows underneath my knee.
Yeah, so you might be supported.
Just to completely relax.
Yep, so you might be supported. And then, because obviously once you bring your feet a bit closer, you feel a bit more stable there.
Yes.
But if you can't get there, you might be further down. And your first aim of movement might be just to get your feet closer so you're more comfortable in that position.
Yep.
Now, there's two things that I would do in this position. The first one is just bottom wiggling. So really gentle bottom wiggling.
Like
and you can see how well Tom's tummy's moving there. For a lot of people, when they're in loads of spasm, they just look rigid. They really, really struggle to get any movement going.
So it might be like
whole
body rocking.
I wouldn't want that much, but you just wouldn't see so much pelvic movement there.
Okay.
But it doesn't matter. Any movement, small movement, will get you to bigger movement. If you try and force movements, you're not helping yourself.
Yes.
So go with what you can get. A twitch is great. If you can work on from a twitch, then we progress from there.
And
but
it
if
helps to visualise too, doesn't it? You know, you may appear to be quite stationary, but in your head you can feel movement going on in your spine, and if you run with that, it should evolve into greater, more global movements, shouldn't it?
And if you think about your pelvis rather than your back, so people are always very afraid of moving, they don't want to make things worse. Think about wiggling your pelvis. You're not hurting your back at all, you're not trying to move your back, you're just thinking about wiggling your pelvis. And by taking the association away from your sore point to the functional movement of another point will often help you to go. So you might start with just wiggling your bottom. That's going to help to switch off the big muscles and switch on some of those small, really important muscles that we want to get going again. When people are in pain does two things. It switches on the big muscles, and that's the muscle spasm that we feel, and it switches off some really important muscles. So and that's often when people say, I can't switch on my core, and pain's just switched off the muscles. Again, another reason why we need to take the analgesia. So starting with some small movement around the pelvis, that might be a really nice one to start off with. And then from there, you might just start with some gentle sliding of your legs up and down. So this might be all you can do to start off with. You might not want to think about moving your legs higher up in the air, but you might just start with some sliding. And I'd always do one side and then the other side. So don't try and move two legs together. It's far too loading on the spine. Once you can get up into this hook lying position much more comfortably, and you're happy, you can even try some wiggling side to side, sort of rocking your legs side to side. Any movement at this point is good movement, so go where your body's encouraging you to go. From here, we then want to take you into knee rocking, and you may need some help to get into this position. If you're really, really struggling, you need to see us, and it might be that we need to come out and do a home visit. This is certainly one thing that I'll do when people can make it into the clinic. and sometimes you need a little bit of support to get the legs up. I'll often assist with the lifting, so we'll assist you up to here. If you're really struggling and feeling like everything's grabbing on, giving a little bit of resistance, so I'm almost pushing you away as you're pulling in, just gives you much more confidence to switch things on, and that just allows you to come up to here.
It's support, isn't it? You're bracing me.
Yeah.
So that when I attempt to activate my muscles, I don't feel as if I'm at risk of blowing out or
takes you
moving
away from
too
that
far.
panic mode, really.
It's
You know that
giving me
you're
a
not going to go
constraint.
anywhere.
Yeah.
And then from here we bring you in and we bring the other leg in, and for a lot of patients they'll be able to do this themselves. It might take a while to creep them up, but you can do this and you can hold on one hand on each leg. So you're going to bring your left, that's it, left to left and right to right. And from here, again with the bracing, if you cross your ankles across, it just makes you feel safer. And I would just take your hips out to where you feel comfortable. And this is the classic knee rocking position that we use with the back block. So for a lot of people, they might have done this lots before if they already do the back block. Super gentle. So we are not trying to fight against the muscles, to squeeze the muscles and stretch the muscles to get them to switch off. We're trying to send the muscles to sleep effectively.
But I think a key point here as well is, correct me if I'm wrong, all the weight of my lower body is currently held in my hands. I'm not doing a hip flexor movement like this.
It's all through the arms.
It's passive movement that's performed by my arms. There's
but also very gentle through the arms, so we're not getting big bicep activation going on there.
That's
super gentle. Imagine you're rocking a baby to sleep. Very gentle. I would close your eyes. If you're at home, I'd close your eyes. Just get into that zone and let your body guide where you want to be. Now, I generally start with rocking forwards and backwards like this. Sometimes you might want to rock across to the side. I really like the side to side one. Some people go around in circles, but I would just start super gentle. Don't expect to go far. And it might be that you're only doing a few seconds of this and you think, you know what, that's enough, and I want to go back to my position. So when we're talking about interspersing rest with exercise, that may be it. You know, you might just do a very small amount and you go back again. And then the next time you think, okay, I reckon I can do a little bit more, and you might go a little bit further with your rocking that time. And then if you do feel like you can start to activate your muscles, you can then start to add a little bit of abdominal work. So you can start to pull your knees towards your chest.
So I'm still supporting
my
legs,
always still support
but I'm now trying to add abdominals in.
So you may suddenly feel loads better, but you still want to give your body that support.
So just for the purpose of demonstrating for people watching this, the movement you're talking about there is, imagine for a second that my hands are no longer supporting my knees. I'm using my abdominals to perform this movement. But in an acute setting where it's really sore, you're saying keep them on.
Still supporting. So your abdominals are helping, not creating all of the movement. You're just trying to wake those abdominal muscles up.
Incorporate more.
Small, and you will really struggle to feel it as well. When you're in a lot of pain, you will almost feel like you're trying and it's not going anywhere. But that trying's enough. Just trying is enough.
From a neurological perspective, there will be firing going on.
And each time you go, it'll get easier. And then further down the line, you will be able to do your rocking much more confidently. You'll get a bigger range, and you'll be able to add in those curls without your arms. But that's when your body's much happier. It knows it's not going to make anything worse, and you're much more confident.
And how? Let's say I'm on my own at home. How do I get out of this position?
So again, I would take one leg down. So you uncross your legs. I would take one leg down, and then take the other leg back down again. So and
just rest here.
That's your ideal. When your back is bad, you can't do your back block exercises, you can't do any other exercises, your knee rocking is your go-to exercise.
So usually I'll precede knees rocking with a pelvic tilt. Would you do that?
Well, I just think when people are in a lot of spasm, they really struggle. I just think they struggle, whereas this is just that gentler. You can try doing a pelvic tilt, but I
so
just
the
feel
pelvic tilt is where you would try to press your lower back against the ground.
And
so
effectively you're getting that. You're getting that when you're doing your knees up. So we talked before about lying flat on your floor and your legs are down and you're arching, and then you bring your knees up and your pelvis is coming back. So you're getting that pelvic tilt with that movement. If you know what to do with the pelvic tilt and it feels comfortable, go for it. You know, don't be afraid of movement. But at the same time, for some people that will just encourage them to tighten up a little bit more.
So So essentially, the second part is rest interspersed with gentle movements.
And that's the movements. So
And
you've got your wiggles.
Those are the movements.
And you've
Wiggles,
got your
the knees
rocking. But if you can't rock, it's just those legs up and down.
And then also the movements associated with getting in and out of the positions of rest, yes?
Yeah, and movement, rest interspersed with movement might be having a rest and then getting up and walking around. Once you can get to the point where you can walk around, walking is your movement.
Ideal. Yeah.
I would not just do walking, I would always do this rocking, and when you're bad, I would be doing this hourly.
Okay.
But as well as this, get up and walk around, because walking around is really powerful.
Okay.
And with this rocking, people always ask, everyone wants a recipe for how long, how many times a day. Go with your body, listen to your body. For some people, you might want to rock for 20 minutes, you know? For others, they may manage a few seconds and then they might need to rest. So listen to your body. If your body feels like you want more, go with it. If your body feels like it's had enough and needs to rest,
that's a really important point. So we can't advise you on number of sets, repetitions, or how long. It really has to be an innate.
Yeah, and it's frustrating, isn't it? Everyone wants the perfect recipe,
Structure.
but everybody's different, and that's where we make the mistake, and where patients don't get better is if we try and give them the same program. It just doesn't work. And as soon as patients start to listen to their body, close their eyes, feel what's going on, they know what they need to do. I think a lot of people know what they need to do. They just need to be encouraged in the right direction.
So maybe as a rough guide, it could be anywhere from 10 to 20 to 30 minutes of doing these rest interspersed with movements, and you might do it every couple of hours throughout the day, because back pain can wreck your day. You might have to take the day off. So.
Definitely. And when you feel like you're improving with this and you want to have a go at getting up, get up, have a walk around and see where you go from there. Going back to our positions of rest, so we talked about this hook position, but also an astronaut position. So especially once you've got yourself to the position where you can come into doing your knees rocking, if you hold onto your legs there, if you've got someone else around, get them to bring in your chair or your coffee table or your stool or pillows if you need to. And so you're up in that position from your knees rocking, and then they allow you to prop it. Gosh, your leg's too long, Tom.
Well, this would work. I mean, if this was the only thing I had available, I would be stoked with that, but yeah, people get the idea.
Ideally, you want to be a bit more supported underneath the
I mean, you could position the chair so that the backrest is there, but people get the idea.
But going from this, so for some people they struggle to get to astronaut, but if they've got to the position that they can get their knees up closer and they can do their rocking, someone brings in a support, then they can relax in astronaut, and then coming back into your knee rocking the next time is easier, and that's where you can see that you start to make some progress.
Okay, excellent. One other question which I think is always interesting to hear, what do you think of heat versus ice?
Oh, you know what? Most of the time I will tell a patient to use heat for their spine. Just who wants to put ice on their back?
Yeah.
Some people do, some people love it, and for some people they might do contrast, ice and then heat, so one and then the other.
It's such a debatable topic, isn't it?
With any other injury, you'd say ice for the first 24, 48 hours and then heat later on. But I think because of what we're managing, are we really getting down to that small little bit that's been injured in your spine, if there's an injury, or are we managing the muscle spasm? Now I would argue it's the muscle spasm we're managing, and for that you want heat. If a muscle's in spasm, what muscle wants ice put on it?
I usually give the analogy, where do you keep your honey at home? Do you keep it in the cupboard or do you keep it in the fridge? And people say, oh, in the cupboard, why would I keep it in the fridge? And I say, well, of course. I mean, some people keep it in the fridge, I think, to keep the ants away. But the problem is, if you take it out of the fridge to use it, you have to wait for a period of time before it warms up and is usable. And in that sentence, you have to wait until it warms up and is usable. It's the same with our bodies. If it's cold, it's not usable. We need to warm up, push and prime blood through our system before it can run, jump, and do all those sort of things. And when honey's stored in the cupboard, it's ready to go. You can spread it on whatever or use it. But the other thing is, with heat, my understanding is that heat causes vasodilation, which is expanding the lumens of the blood vessels, so that blood can travel through to the system and transport all that nutrient-rich medium which we need to repair tissue, feed it, etc. Whereas ice, it's a vasoconstrictor, isn't it? Or cold. It causes constriction of the vessels, and it makes it harder for blood to get through. So we don't have access to the muscles.
Yeah, it depends if you're trying to push away swelling and things. I just think, it's all to do with injury. How are we trying to manage the injury? Are we thinking that you're locked up because everything's protecting you, and we're trying to get it moving, in which case you want that heat? Or if we think there's a bigger injury underlying and we need to get that ice to settle it down, that's what people sort of.
So I agree with you. I think my preference would be to use heat, and ice. What I will say about it is that it does have a numbing effect. It has been used in history for analgesia as well, hasn't it? Just to numb pain.
And I think a lot of people feel like when they've hurt their back, they're properly injured. But for some, it can be. I remember Sarah Key talking about how it might just be the joint capsule that's got a bit caught when you've moved awkwardly, or we've been loading down that facet joint, and then the capsule has become a bit pinched. And a small pinch of the facet capsule isn't necessarily a huge injury,
but it can be excruciating.
It causes a massive
like a paper
muscle
cut.
spasm. So it's that body's overreaction to something that brings on all the pain. The pain often is resulting from the muscle spasm.
Yes.
We're trying to calm down the reaction to the initial injury rather than the injury itself.
So people can try heat. That's our advice.
If you're feeling called to ice, go for the ice. Only within the first 24 hours, I would say.
Because it's not
beyond
going to do
that,
anything.
heat's the way I'd go.
So then, if we briefly talk about treatment, treatment of lower back pain, we could be here for eons. But Mackenzie is, if you were to assign a word to Mackenzie technique, you'd think extension. And for those who are familiar with the Sarah Key method, you might just pick the word flexion. But we said in the beginning, do not bend, or I said that, sorry. How do we feel about do not bend? Why are we advising people to not follow that?
Yeah, similar with McGill. There's all these different people who want to give, and like we were talking about before, a recipe. They want to give a recipe that everybody could follow. That doesn't always work in that way. The reason why we want you to bend and we want you to move. So I'm not telling you to bend down and touch your toes when you've just hurt your back. But you need to move because the spine is made to move. We've got all of these different vertebrae. You've got all the different facet joints that want to open up. Now, if you lock this up, if you put a brace on and you lock it up and think, well, if I stop it moving, it's going to make it better. It's going to allow it to heal. You're losing out on the metabolism of all of these different discs. So we know discs aren't like cartilage where they wear away. You've got to have that pumping action through the discs to keep the metabolism going.
That's a key word. I think that's probably the most important thing you touched on there. You cannot encourage continued metabolism without movement because they don't have a blood supply, do they? And
we all know how stiff we feel if we're in the cinema and we've got a stiff knee and you sit for a couple of hours. These poor facet joints want to move, and often most of the patients I see, and I think Sarah Key was the same, most of the pain is coming from the facet joints. We worry about our discs. Yes, we have issues with the discs. We worry about our discs, we worry about our nerves. A lot of the time, the pain is coming from these facet joints because they're jammed up and they're stiff. And what is worse for a stiff, jammed up joint than encouraging it not to move and allowing it to become more stiff and jammed up? We just need to ease that movement back in, and that's the way to get it better.
And that's why predominantly, both you and I, our treatment is largely manual, isn't it? And we encourage home exercise as well. There's plenty that we can do for people in here to make them feel better when they leave, but it's vital that they consolidate that improvement. And by moving.
Especially, you can be hypermobile, you can be able to touch your toes, but there can still be pain going on there. We can look at people and say, well, why have you got back pain? You're moving beautifully. But if there's one sore facet joint that's jammed up, everywhere else may be allowing them to look like they're moving beautifully because all of the other joints are taking over. But one sore facet joint still gives you that pain, and we need to find that spot, ease that back into movement. And then with your home exercises, you keep that moving and stop that chronic issue coming back again. Then you're sorted. If we just go for the stretching, strengthening, and don't touch a patient, you don't find that pain, and that's often why they don't get better.
And things like dry needling, chiropractic adjusting, mobilising, the scanner, these are all different ways of stimulating movement within tissues, aren't they?
Yeah, and for me, the primary treatment for anybody is getting my hands on and finding the sore spot and easing it out.
Or your feet on.
Spot, or my feet on. But finding the bit that's stiff and not moving and working with it. If a patient's highly irritable and I can't get in there, I will then think of one of those other forms of treatment. I try the needling to try and settle the system down, using the physio to settle the system down. But generally, I just want to get my hands on them. You can go in super gently and make a world of difference.
Yes.
Equally, if we feel like we're getting in but something's not quite letting go, again, sometimes I'll go over to the dry needling, because that's the bit that just allows that last little bit of letting go if it doesn't want to go with therapy.
So then, just a couple other things. Imaging. How important is imaging in all of this? Do we always need a picture, and do you have a preference, like MRI, CT, X-ray?
So if we're worried about something going on, if there's red flag issues, something that's concerning, if people have got signs of cauda equina syndrome where the nerves being compressed, they've got bladder and bowel dysfunction, anything like that, yes, we want to go straight for some imaging, and we ask the GP to send them for an MRI. So in that sort of situation, muscle weakness, calf weakness, if they can't do a calf raise, there's evidence that there's sort of some serious neural pathology going on.
They can't walk on their heels or their toes, something like that.
If there's some sort of serious alarms going off, we would want to send them.
But generally you can get by without it.
If they haven't had trauma, if they've not likely to have had a fracture or anything like that, I would not send anybody for any kind of imaging unless I'd treated them and got to the point where I felt like, there's something going on here that I can't find, and we need to look a little bit closer.
That's a good point. If you haven't fallen off a bridge or been in a car accident, anything that would justify, hey, I actually think I've broken something here. If you've just woken up and you're in agony, it's unlikely that there's a fracture. It's just what you said before, the body's overreaction to something that could be as little as a paper cut, or a pinched facet.
Sleeping slightly awkwardly.
Okay.
So unless there's something that's been creeping up for a while, if there's sort of evidence of possible cancers and things like that, obviously we want to take it seriously. But if it looks like it's a fairly simple onset and we're not too worried about it, then we'll crack on and we'll get in there.
And you can try these things that we've gone through.
And in terms of imaging, the X-ray would always be first. You'd always start with an X-ray before an MRI. But certainly looking for MRIs, we're really scanning to see whether an injection or surgery is appropriate. And for the vast majority of patients, I really want to keep them away from surgery. I might consider sending them for an injection, but for most people, once they get that scan, I just find a lot of the time doctors are keen to send them for these images because they want to find an answer. But you can't find an answer from a scan or an X-ray.
It's just a picture.
Sometimes you can, but really, people can have awful looking spines on a scan.
And be asymptomatic.
And be asymptomatic. People can have beautiful looking scans and you can't find anything. And really, it's easy to jump on a disc bulge or some irregularity in the spine, which many people might have anyway. Disc bulges can change during the day. Disc bulges will show up more if you're in spasm because you're pushing down on that disc and it's encouraging it to push out. If you reduce that spasm, everything lifts up a little bit. So there's a lot that can affect what you see on a scan.
And a picture, an MRI, an X-ray, is just a picture in that moment in time. So like you say, there could have been a bulge at that time, which may not have been as present the week before or something like that.
And the biggest thing that you cannot see on the scan or an X-ray is stiffness. We can assume stiffness.
It'd be nice to have an animated X-ray.
It'd be nice to see what's moving better than other areas.
Or an animated MRI. But
we can guess that an area is stiff if there's some sort of inflammation around a facet joint. If a disc is thinned, we assume there's not a lot of movement around there, so therefore you say, well, that area must be stiff. But really, to find the stiff point that we've just been talking about, you need to get your hands on. And a lot of the time I'll find something that won't necessarily match up with what's been diagnosed from a scan or an x-ray, and that's the patient's pain, and they know when you've hit the pain.
And to sum up that valid point as well, it seems disc bulges are quite normal. They don't necessarily explain why you're feeling the way you do. So don't give them as much weight as what
One of the biggest parts of my job is reassurance. If people have had a scan, they just want an
answer.
They want you to explain their scan to them. And I've had people who've had what they thought were awful scans, and they almost want the reassurance that it's okay, that it's They kind of say, they want you to say it's awful and look, we're not going to get you better, because they kind of just want an answer, you know.
It's a strange resolution.
They just want you to say, well, this is why you've got lots of pain, and maybe you're going to have pain forever because of this. And often I'll spin it it's completely the other way around, and I'll say, you know what? I see this all the time. This isn't bad.
This is normal.
We can do something about this. This is fairly normal. There might be something going on, but that's not the answer to why you're getting your pain, and that's not stopping you from getting better. And when you tell someone that, the weight lifts off their shoulders and they're halfway to being better already.
I think that's very, very well put. So last point, the best exercises that we can do for the prevention and maintenance of lower back pain. I think there are 5 really good ones which I learned through Sarah Key. That is the pelvic wiggling, the pelvic tilt, the knees rocking, the reverse curl, and then child's pose. That little 5-point protocol. Things like the back block, toe touches, all these sorts of things which we can show you in other videos how to do. But are there any go-to exercises that you think everybody under the face of the sun should be doing? Well, move. I mean, you need to move. You need to move. You need to bend. Don't be afraid of bending. All that bending that you can do during the day that people can either do or avoid doing. As soon as you stop people avoiding, you're stopping that metabolism.
Just to pick up your newspaper off the floor, or
it's okay to bend up and pick up like that, isn't it?
Bending normally.
Everybody thinks that you have to sort of like protect your back and pick up this way.
If you're doing something very heavy, yes, we need to think about how you're moving. But if it's a normal picking something light off the floor, reaching down to do something, you really should just let yourself bend.
Let yourself go.
And that's easy to say when you're not in pain. When you're in pain, everything's very different. A big one in terms of movement when you are in pain, which I actually encourage my sister to do. She's in the UK, and obviously I can't get my hands on her. But this was a big change for her, was learning to stand properly. When you're in pain, you use everything you've got and you try and work out how you can get out of your chair. And this is the McGill one that we did on McGill's course, where you're, again, not thinking about your back. Don't think about the painful area, think about the function. And think about moving your hips forwards. If you move your hips forwards, you will get upright. Your back doesn't really have to change position. So you can stabilize your back or not. You don't really need to. But you move your hips and you're upright. If you just push forwards, not only do you really protect your back because you're not doing much through your back, but you're working your glutes, which is what should be working. As
opposed to like
if you push yourself up, sort of you're using your back, and you can feel that. If you do it, you can feel that you're using your back to get up. Well, you shouldn't be using your back anyway. So a lot of the time people are in pain because they're trying to protect themselves, but in the end they're using the wrong muscles. So just standing by pushing that pelvis forwards gets you up, feels so much easier. So just changing the way that you move. So normal movement, use the right muscles. Don't try and protect yourself. Don't be the patient, try and get back and have the confidence that bending is normal and it's okay.
And what about the back block?
So the back block's amazing. The back block,
do you think everyone should do that?
All of us should do it every day. I don't do it every day.
Okay.
What patient does?
I'll link to, at the bottom of this video, I'll link to how to use the back block and those other 5 exercises that I mentioned. We can link to some Mackenzie stuff as well, but The back block's a good one. But I tend to think that everyone should do the back block.
Yeah, and I know you've done the video. I'd certainly say you can start with the back block. Some people might be able to fix themselves with the back block. They may not need that hands-on. I'd always recommend people come in and let us assess them first.
Yeah.
And certainly in terms of using
it's a little
the back
bit
block,
more complicated than what it seems, isn't it? The back block.
The back block and even the knee rocking, you know, if you don't do it right, if you don't get the technique right, it can make a world of difference. And if we hone your technique and get you doing it properly, it can be life changing. And it might be something that you just do once or twice a week once you're better, but certainly when you're bad, and for a lot of people, if their back's feeling bad, they just want the back block, they just crave the back block. And it's knowing when to use it, when not to use it. There's a lot of points around it, but it effectively the routine is so simple.
Okay.
So easy for everybody. Meditative.
Last point. Power lifters, you know, lifting hundreds of kilos off the ground and on the back of your shoulders. Where do you stand on that?
Oh, technique. It's all about technique. So we just talked about standing up and using the pelvis. With any sort of loading, it's about technique. Now, I hate telling people not to do exercises. That's my big thing. And
especially if it's something that they're passionate about, like powerlifting.
Yeah. And maybe it slows down some people in terms of getting better, but maybe it moves them on as well because they're confident that they can. Then they're not afraid of their back anymore. They're confident that they can still do things. Obviously, when you're in acute pain, we need to advise you getting back to things. So you don't magically feel better and go straight back the next day. You know, you have to ease back into things. But generally with exercise, as long as technique is correct, and it might be that we need to assess technique or they need to get a trainer to really have a look at their technique. I would encourage exercise is okay if that's what you want to do, but after exercise, if you've loaded your spine that much in the gym, for anybody lifting weights and loading their spine, they need to be doing the back block routine at the end. So we switch muscles on. Yes, we want to switch muscles on to get encourage building strength. But at the end of that session, you need to be able to switch off. If you go to bed and everything's still tight from your training in the evening, everything's jammed up, you're not getting that metabolism that we talked about. We want everything after training, whether it's a hard run or weights, we just want everything to let go. So you work the muscles, but you teach the muscles to let go. And that's one of the keys to why patients don't get better. They're trying to make themselves stronger, but they just don't know how to let go anymore.
So I think, to reiterate an important point you made there, neither of us are telling people what to and not to do when it comes to what they want to do. You know, I think whether you think lifting 400 or 500 kilos off the ground or squatting it is good or bad for you, that's not the point, it's irrelevant. People are going to do what they want to do. But what we are saying is, if you're going to do these extreme sort of lifts, you need to introduce some sort of management plan, because to leave that out is just stupid, really, isn't it?
Well, and it's exactly the same as someone sat at a desk all day. You know, if someone sat at a desk all day, again, I want them doing the back block. Again, I want them doing the back block to open things out, to go back into that sort of anti-sitting posture, just to give your spine a break. You know, you can't just do all these things that are loading your spine and not offload it afterwards. And if you do add that offloading, it makes everything so much better.
Well, let's leave it there. I think we should probably finish off by saying, you know, these are our opinions, and as a bit of a disclaimer, you should always consult with your professional before attempting some of these things. But for the most part, this is some pretty safe stuff which we've gone over, which most people would be, on average, perfectly fine doing.
Definitely. And just don't be afraid of your back. You know, don't be afraid of pain. Doing some gentle exercises like what we've done is not going to make anybody worse. So
if you want more answers, please feel free to get in touch with us via the website. Kate, you've got your own website. Is it backphysio?
www.thebackphysio.com.au.
Excellent.
Yeah.
Thanks for watching, and thanks for your time.
Oh, that's all right. Great to know that
brilliant.
chiros and physios have similar opinions.
Yeah, we're still friends. Okay.